Jocelyn, thank you so much for joining us on TNT Open Mind Insights. It's a pleasure to have you here because you have an amazing journey, different professions in the healthcare, different realizations that you've had. I really want to cover your journey, from pain management all the way where you are right now, the things that have you seen, the barriers, and the things that the healthcare industry is doing to tackle those barriers that you've seen. But before we go there, what drove you to this field? What made you say, I want to join the healthcare industry?
I started working as a nurse practitioner in 2019, and my first role was in pain management, where I worked for more than 3 years. So honestly, I don't know why did I go to pain management, but before I became an NP, I worked 2 jobs as a bedside nurse. I work I worked before in ICU, ER, med surge, long-term rehab, and acute rehab. So I have all those experience, and I felt like I got exhausted, working 2 jobs and doing nurse practitioner school. So after I finished this school, I decided to go into pain management because I have this impression that what I'm gonna do is all just refill the medication or prescribe pain medication. But before I became an NP, on my bedside nursing years, I would say like on my 9 years as a bedside nurse, I've noticed one thing, which is one thing that really stood out to me. Um, the the prescription of the controlled substance, especially the pain medication. I grew up in the Philippines. I moved here when I was 20 years old. So back home, I don't really encounter uh, too much controlled medications, and we consider it very like strong medication. So when I started working here as a bedside nurse, I was like, why do every almost like simple case, like why do they have to prescribe like very strong one? Even just for me, like a simple knee pain, like why do providers or physicians prescribe like oxycodone, hydrocodone? So I have the background already like about the pain medication. And when I started working as a pain management nurse practitioner, so I saw it firsthand. Just prescribe pain medication for whatever pain complaints the patient have. And before, like I said, on my bedside nursing years, it seems like physicians, nurse practitioners, it's easy for them to prescribe controlled medications. I have this experience before where a patient is on PRN pain medication on top of the scheduled pain medication, and they get anxiety medication. So too many like controlled medications. So I thought it's just like, oh, okay, it's easy to just prescribe that pain medication. So I, as a bedside nurse that time, I'm like, I don't really see the, like the effect, or I would say like, I just give the medications. But when I work in pain management, I saw the difference because I realized that, as a provider, it's your responsibility to monitor the patient. Don't just prescribe the pain medication, because I saw how it affected patients' lives. I have the several patients where they mentioned to me that since they started taking the pain medication, it really changed their behavior. They became addicted to the medication. And they even told me that it even changed their relationship with their family.
You mentioned someone you know also to me
Yes,
that
and
you didn't think, yeah.
yes, I even have this close friend before who became addicted to pain medication. So on my mind, I'm like, what's going on with this pain medication? Why everyone is so hooked up with this medication?
So what was the turning point for you?
There was a time where the patient threatened me that she's going to, kill me if I'm not going to refill the medication. So she was a very young patient on her 20s. and always have like negative urine tests. So and then at that time, I don't see a medical reason to continue refilling the pain medication. So I discuss it with her and with a good heart because my intention is to end the addiction because I see that she became addicted to the medication because she always come back like 2 weeks after the refill of her pain medication. She will come back and tell me that she lost the medication or either someone stole the medication. So, and I saw the pattern, like not only to one patient. So I see it. And I'm like,
After that time, you kind of said,
yes, I told myself this is not me. I became a nurse practitioner to help people, to take care people, not to become like one of the people like pushing the medication. So my goal is to help the patient, not to push them to turn into addiction.
And that brings you into that's how you,
Yes. So after that, I I started working at primary care. So my current job, we do like medical service and shelter to homeless people. Honestly, before I started working um in my current job, I have this stigma before about homeless people. And
what was that like? What was that about?
I used to think that homeless are because of laziness. That's why they became homeless. And I used to think that people that has addiction is because they chose that kind of lifestyle. So, so in my current job, I observe that most patients that are homeless, they have mental disorder and addiction.
But why now? Why the drive to help this under resource? And I know you mentioned earlier about a call-in, and what is that about for you?
Um, I have so many reasons. Honestly, at first I thought I'm just enjoying my job. Um, I thought I'm just like, okay, they are homeless. They're not gonna be like so many like picky. Like it's gonna like just an easy one, like just talk to them or prescribe what they want. So, like I said, I have that stigma, like, oh, like okay, whatever your reason is, you're homeless, you're addict, you did that. I used to have that stigma. I admit that, I'm one of those providers or nurse practitioners that, like stigmatize the patient already. Like you don't know the whole story, the whole thing, and you already give them like an impression. So, but hearing their stories, it really touched my heart because I would say the common denominator, it was not their choice in the first place. It's so there most of them, they mentioned to me that they started using drugs or drinking alcohol at early age because like this they feel like nobody's listening to them.
Yeah.
Like they don't really care about their situation.
They're not, no one, like they feel that they're not heard, they're not being heard.
Yes, yes. I would say like 80% of them because of that reason. And then I would say 20% of my patients because of the mental disorder that they have. So they tend to self-medicate. So they thought that marijuana could cure what they have. So they self-medicate because of financial issues.
Financial issues.
Yes. And then that leads to their homelessness and leads to other medical illness. So upon hearing their stories, like different stories, I realized that wow, this is different. If only all the providers, if they have the heart to these people, it will not happen to them.
What do you think the biggest barriers are right now that keeps those folks from getting the care that they need?
I would say it's because of the stigma. So providers should remove that, the stigma, because it will not help the patient at all. It will just, it will just not it will just make the patients not to do the proper treatment because they get ashamed already because of
Yeah.
the stigma. And number two, the being responsible as a provider, don't just prescribe medication. So you
Like
have,
you get to know the person, right? Like
yes,
get
get
to
to
know the
know the
patient
person,
and
get to know
listen
the
to them.
patient, know the situation, listen to the patient, because most of the time it's their soul that is in pain, not their physical
I love that.
body.
I love that. Can I say that?
Because I see that nowadays, like the compassion is fading, which is so sad. Like that's what everyone needs, Some people, they get sick, and then the provider or the nurse, they don't have the compassion to take care of the sick, and that will make these patients like sicker.
What would you tell providers that say, yeah, you want me to be compassionate, but I don't have the time?
That's one of the barriers
That's one of the
too. I
barriers.
would
Yeah.
say yes. That's one of the barriers. That's why I love my current job right now, because that's one of the reason why I left my previous job at pain management, because they always give us like 30 to 40 patients, which is impossible to, like take care each of them. Yeah, as much as you want to like take your time, listen to them. You have like a couple more patients waiting for you.
Yeah.
So at my current job, at least they give us like 30 to 40 minutes.
Nice.
Yes, that's
It's
why
amazing.
that that's why I have time, like sit down in there, talk to the patient. It's just like how we are doing. Like,
Yeah.
it looks like it's not a patient visit at all.
It's just kind of
Because
like a
yes.
conversation. Yeah. I heard that your director encouraged you to join the TNT
Yes.
Fellowship program. What do you think was going through the director's mind when they encouraged you to join the program? What problem do you think, or what barrier do you think that would
We
tackle?
need, I'm sorry.
No, it's okay. Yeah.
We need more providers. I would say we need more psychiatrists in Las Vegas. We don't have much psychiatrists, psychologists, or behavioral therapists. At my current job, um, like patients wait for months just to be
Months?
seen. Yes.
You say months.
Months just to be seen. And me, I'm not that
Is it a
trained.
rural area, or is it what's the area look like in that? Or is it?
Because I work in outreach, so we
Okay.
go to this underserved
Okay, gotcha.
area. There are days that I go to underserved areas, but majority of my days they
Yeah.
put me at rescue mission. It's a recovery shelter place.
Okay, gotcha.
Yeah.
Yeah.
So I would say one of the barriers too is we don't have much
So it takes months for
psychiatrists.
someone
Yes.
to get a hold of a doctor or a healthcare professional.
Yes.
Do they have access issues, or
They
like
have access
how
issues.
can you describe a little bit about that?
Um,
What are some of the access?
Financial, most of them they don't have insurance. Yes. So if they don't have insurance, then they will be assigned to a different provider who's taking who
Yeah.
take care of a patient who doesn't have insurance. And like, and that's bad because they have to wait for a couple months.
Yeah, I was gonna ask you, like, how do they get care? Like,
Yeah.
how like someone in crisis, someone with a
That's another thing. Whenever we have a patient that is in crisis, we have to send them to the ER. So
how
that
far is
will
that?
that's like 30 minutes away.
Oh wow.
But then for me, like sending them to the ER, and then they'll just be seen there. They'll just prescribe them medication, then send them back.
Yeah. Yeah, I can tell why. I can see why you were encouraged, because that's one of the biggest, from my understanding, that's one of the biggest gaps that the program wants to close. The accessibility and the through training and all of that. What are your hopes? What are your hopes? I know you're just joining the program. So far you're enjoying it, but what are your hopes on the things that you can learn to address like addiction medicine. I know you're passionate about addiction and how to, your goal is to reduce addiction basically and get rid of it altogether. What are your hopes to learn and how do you hope to use the information that you learn to achieve that goal?
So I'm so glad that I'm here to be trained, because that's one of the reasons, because we want to be trained. I know we're not gonna be like those psychiatrists or psychologists that will like how to handle a patient that has like mental disorder or addiction. At least once I get trained here, that will add more knowledge. And then I will try my best also to train the other providers, and then to share them the information that I will get from here, because that's our main goal, to train the other providers and or the other uh, the nurses or those who work at healthcare, like in order to reduce the number of patients that has addiction.
Yeah. I think it's powerful, the fact that, because it's kind of like a 10x effect, right? You train somebody and that person trains another one and trains another one. From your experience, do you have any examples that you can kind of share about patients that were unable to get the care, that were not able to get the assistance?
I have so many. I would say majority of my patients are either homeless or doesn't have insurance.
Okay, so
And
that's
they're always the ones who suffer depression, anxiety, PTSD, their mental health is being affected. And then it starts from there. Once their mental health is not addressed, it affects their physical health also.
So it's integrated, like the health and the mental health and the physical health.
And then that will like lead to frequent hospital visit. So we don't have enough doctors already. We don't have enough psychiatrists already. And it's like drowning. So I think it's good that we have this program, that we are being trained, so we could share the information and we could train the other providers also.
Yeah.
Yes.
Yeah. Jocelyn, you see people every day, in your practice, you're super busy, you see people coming in, you sit down with them, you have these conversations with them, you get to know them. So your perspective is super powerful. What other things come to your mind that can be solutions to all the barriers that they're having from your perspective? It's something that maybe something that has not been done yet that you think of it could be done.
I would say kindness, and communication. Kindness, because we don't know what others experiencing in life. They're carrying too much. All of us has this, struggle in life. So
how does that look like
honestly,
to you? How
so
does kindness look like to you?
at least kindness to the patient. Listen to them.
To them.
Yeah, listen to them. Make them being heard, because their situation already is painful. Yeah, like I said earlier, I feel the pain in their soul. Yeah, they're lonely, they're hopeless, and I see fear in their eyes. So at least kindness, and then try to understand where is this all coming from? Like some of them, like they're not compliant with the medication, and they keep turning to drugs. So because there is something going on, so at least kindness. Number two, communication with the other specialists or providers. So I know most providers, most physicians, they're so busy, but at least have a proper communication. Don't just see the patient, send the prescription. Keep referring the patient to a different specialist. Patients doesn't need a different specialist. I've seen that multiple times. They keep like, this test already done, and then another specialists or providers like
Yeah.
ordering the test again. So it's like a waste of time and waste of money.
Mhm.
They're already drowning,
Mhm.
and then if
And
you
you
just
add all this
yes,
to
so
it.
that's not helping already.
There's a lot of stuff going on right now with like laws and it's a very controversial time right now, but like there's a lot of laws that are in work right now. Tons of organizations, probably your organization is one of them, that do a lot of work. What do you think people that actually write the laws, what do they should know about this? Like,
Actually, that one too, I want to say something like those who are working, like those who the lawmakers, they should focus on mental health also, because I noticed like I'm not sure here in California, but in Nevada, we don't have much. We don't have much. I would say, what's the right words for that? The mental health there
yeah.
is, I feel like it's being unseen. It's not being taken care of.
Hmm.
Yeah, in Nevada. So,
Do you
but
think it's a priority?
no,
You think it should be a priority?
it should be a priority.
Hmm.
Yeah. So lawmakers should focus on to pass a law, like at least to prioritize the mental health
Hmm.
yeah area.
How do you think that will benefit the overall community and overall state, overall country? How do you think the focus on mental health from their perspective? How do you think that will help us as a community, as a state,
Mm-hmm.
as a country?
Mm-hmm. Um, if we focus on the mental health of every patient, then I would say there will be a progress, and I strongly believe that that will reduce the number of addiction also.
Hmm.
Patients feel like they're being heard
Hmm.
on their issues, then for sure it will help the family, the community, and then the country.
Yeah. Yeah.
Yes.
Yes, and we need that. We
Yes.
need that totally. So you do all this work there. You sit with patients, you listen to them, you help them.
Mm-hmm.
You have the passion for it. You wake up every morning and go and want to help. You're helping others every single day. You have a family,
Mm-hmm.
two beautiful kids. You have a partner, a husband, and you take care of these patients. How do you do that? Where do you find the energy? How do you do to take care of yourself?
Mm-hmm.
What are the things that you do to make sure that your cup is full
Mm-hmm.
and that you can kind of share that energy with others? Do you have like a routine or something you can share with
A
us? Yeah.
motivation or
I know faith is very, very big for you.
I have this belief that what you do unto others will come back to you. So I have a I have two kids, and I want them to grow up in a community where it is where it is safe and free from drugs, and
Mm-hmm.
you know um as much as possible, like I want the mental health to be focused or be prioritized, because it's very important,
Mm-hmm.
because if we don't focus on people that has like mental health issue, then that will affect everything,
Mm-hmm.
and that will for sure will affect my kids. So they are
Yeah.
my reason why
The
I
reason why you wake up
yeah.
every morning and do this.
Hmm.
Do you think there's hope for that future without addiction?
Yes, of course, of course. Yeah, as long as everyone is working together and do their part, yes, I believe so. Yes.
Awesome. You have an amazing journey. Jocelyn. You had a really, really unique journey because you've gone through different populations.
Mm-hmm.
You've gone through different types of healthcare settings,
Mm-hmm.
ICU, pain management. Um, and now you're in the under resource serving the under resource community. So you have a whole spectrum. You have a whole you know perspective. Um, what would you like other providers to know? What would you like to share with them um, if they see this interview? After they see this interview, what would be something that you would like to share with them that's important to you that you think that they should know?
I would say We have to play our part. I mentioned earlier about the responsibility. Don't just go there like just working. So we have to extend our hands. We have to help the patients by being responsible on what we are prescribing. We have to teach the patient about the consequences of uh, continuously taking the controlled medications.
So we have to work with patients and educate them on the use of control.
The proper use of the controlled medications. Teach the patient and teach the family also. Yes, and then communication between providers, integrated health system. So like in pain management, instead of just prescribing the pain medication right away, maybe like a proper communication, like referring them first to a non-pharmacological intervention, like maybe referring them to physical therapy first. Uh, like the choice of treatment should be helpful, not to push the patient to the wrong direction.
Gotcha. Gotcha.
Yes.
Thank you for that. You're doing amazing work at Hope Christian Center in Nevada. Is there anything we can do to help or to learn more? If people want to learn more about the center and the work that you guys are doing, how do we get in contact or how can people help? Yeah.
We appear usually on TikToks. We have this on TikTok, social media.
Social media?
Yes, and then we have these flyers also.
Okay.
Yeah, that we put in front of the clinic that they
Okay.
can get. Yeah. So
That works.
yeah, so we share the information about about our clinic, about our goal, because our goal is to help patients, especially underserved
On the
area.
resource, yeah.
Yes.
Yeah, perfect.
Yes.
It was such an amazing time talking to you about this. You have a unique journey and an amazing journey, and I think you have a lot of value in that journey and in your thoughts and the insights. So I really appreciate that you joined us today. Thank you so much.
Thank you.
It was a pleasure talking to you.
Thank you.